Wait, what do you mean you're a resident? Are you a real doctor? Every time I come here, I see a different doctor. I have to explain myself all over again. I'm tired of doing that. After my appointment was at 10:15, I've been waiting for over an hour. I thought our visit was over. You leave for 30 minutes? I mean, this always happens, and now my ride's here and I have to go.
Hi, I'm Dr. Ellen Meltzer. It can be challenging to cultivate relationships and establish meaningful connections when practicing medicine in a busy academic medical center. Yet creating meaningful connections is essential, both for your patient's well-being as well as your own. Research consistently demonstrates that patients have better outcomes, while physicians have less burnout and more satisfying careers when they're able to connect in a meaningful way. Today, I will demonstrate 7 evidence-based strategies to promote engagement, empathy, and rapport. To address the unique challenges faced by our trainees, I'll do this from the perspective of a resident rather than an attending physician. Now, to some, the skills I might demonstrate may seem simple or intuitive, but the literature shows that it's challenging to be empathic when feeling overwhelmed or stressed. Thus, it's always worth taking a moment to review these skills. Remember, there's no one best way to speak with patients and their family members, but today I'm just going to show you 7 evidence-based strategies to promote engagement, empathy, and rapport. Thank you. Here are the 7 steps that we will discuss later and which I will demonstrate. 1. Prepare for the encounter and set the tone. 2. Create rapport, introductions, and orientation to the visit. 3. Empathic communication. Establish the patient-physician surrogate team and set the agenda. 4. Patient-centered use of medical technology. 5. Managing expectations in an academic practice. 6. Create a patient-centered treatment plan that the patient and caregiver understand. 7. Finish with an engaging closure and reflective practice. Step 1. Prepare for the encounter and set the tone. Before entering the room, prepare for the encounter. Review the medical record if possible so that you have some understanding of who the patient is and can immediately connect on a personal level. Next, take a moment to yourself. Perhaps you just finished up with another patient and need to decompress, or maybe this is your first patient of the day. Regardless, take a deep breath, relax, and assume a warm and neutral stance. Remember, from the start, you can set the tone for the encounter. Always knock and wait before entering. Step 2. Create rapport, introductions, and orientation to the visit. The first few moments of your encounter can set the tone for the remainder of the visit. When entering the examination room, be mindful of incorporating both verbal and nonverbal strategies to establish rapport. Greet the patient warmly, sit down at eye level, lean in, and maintain eye contact. If you are running late, acknowledge it and offer an apology. Hi, I'm Dr. Meltzer. I'm so sorry to keep you waiting.
Oh, that's fine. I'm Elizabeth.
Hi, Elizabeth. So I know that normally you see Dr. Jones, but she's not here today. If you are seeing a patient who normally sees another doctor in the practice, provide reassurance that there will be continuity of care. So I'm going to see you, and then I'll make sure that I communicate with her everything that we discussed, so there's absolutely no gaps in your care.
Oh, good. That sounds good.
Okay, great. So before we begin, I'd like to orient you to our visit today, if that would be all right.
Sure.
Okay, great. So I'm a resident physician, which means that I'm still in training. I'm going to take a history, get some information, perform a physical exam, and then I will step out and present what we discussed to an attending physician, my supervisor. I will then come back in and we'll finish up the visit. I may even bring the attending in with me if necessary. Step 3, empathic communication. Establishing the patient, physician, or surrogate physician team and set the agenda. Express a desire to partner with the patient or the surrogate and allow the patient an uninterrupted opportunity to express his or her concerns before setting forth your own agenda for the visit. So tell me, how can I help?
Okay, so I've been having this pain, right, like in the middle of my chest. and it comes on like in the evening, usually after I've eaten, watching TV or whatever, and I'm really worried about it.
That sounds scary.
Yeah, it is actually scary. I'm worried that it's my heart. My dad had a heart attack a few months ago.
I'm so sorry to hear that.
Yeah, he's okay, but it was sort of, we weren't sure what was going on for a while. He had this emergency procedure. There was a blockage, whatever. But I'm concerned about it, and I want to make sure I'm okay.
Absolutely. To demonstrate empathy, recognize empathic opportunities and use communication skills to build rapport and alleviate patient distress. To demonstrate empathy, ask questions and try to understand the patient's perspective. Acknowledge the patient's emotions, validate and normalize them, praise the patient's efforts, and make partnership statements to provide support.
Anyway, it was pretty awful.
It sounds like it. That must have been very hard for you and your family at that time.
It was. So I'm worried that it's my heart, and I want to make sure that you check that out.
Well, that's completely understandable. I think anyone in your position, having a family member that recently had a heart problem, would similarly be worried. So I'm going to do my best to figure out what's going on today. And I really think it's great that you came in to have it checked out instead of ignoring it. Step 4, patient-centered use of medical technology. With the advent of the electronic medical record, the use of technology is pervasive in medical settings. However, the use of technology can present a barrier to establishing the patient-physician team. When using technology during a medical encounter, explain the role of technology and what specifically you are doing. Keep your full attention on the patient rather than on the computer. Continue to maintain eye contact. When patients are discussing sensitive information or are feeling emotional, avoid looking away or documenting in the chart. So if it would be all right, I'd like to take a few notes while we talk. I'm going to open your medical record if you don't mind.
Sure.
Okay, wonderful. Be mindful of how you interact with technology when you are with patients. Specifically, avoid texting or responding to a call or page during an encounter. If you must respond urgently, apologize and inform the patient that there is an emergency. Ask whether the patient has any questions about how technology is used in the practice and address any concerns the patient might have about confidentiality. Step 5. Managing expectations in an academic practice. Interrupting the patient encounter to discuss the case with an attending physician can feel disruptive, both to you and the patient. Be respectful. Inform the patient before you leave the exam room. Set realistic expectations about timing and how long you will be away. Let the patient know that another physician might be joining you in the exam room. Okay, so now that we've gotten some information and I've examined you and done an EKG, I'm going to step out now and, as I mentioned earlier, discuss what we've been talking about with my supervising doctor. This could take about 15 or 20 minutes. I will then come back in and we'll wrap up the visit. Okay?
Okay, the only problem is that I do have to pick up my daughter from school, so I do need to leave in 30 minutes.
Absolutely. I really appreciate your letting me know that, and I'll be certain to be mindful of your time so it doesn't feel like you're rushing out of here.
Okay, thanks
All
so
right,
much.
good. We do have free Wi-Fi, and I'll be back in a few minutes.
Okay.
Step 6. Create a patient-centered treatment plan that the patient and caregiver understand. Engaging the patient in medical decision-making and creating a patient-centered plan for care is just one step in promoting engagement and compliance. In addition, it is essential to ensure that the patient truly understands the information you hope to convey and has the opportunity to ask any questions. Use clear, plain language and avoid medical jargon. Give no more than 3 pieces of information before checking understanding. Employ strategies such as ask, tell, ask, or teach back to clarify any misunderstanding. Respectfully ask the patient to tell you what they understand about the plan or their medical condition. Clarify any misunderstanding and then check again by asking the patient to restate the information you provided. Be mindful that different people learn in different ways, and providing patients with information both verbally and visually can aid in their understanding. Okay, so now that we've had a chance to discuss the plan, I want to make sure I communicated everything clearly to you. Would you mind repeating back what I said?
Sure. Okay, so it sounds like when I have this pain in my chest, it's not my heart,
Correct.
which is good.
Mhm.
It's heartburn.
Mhm.
And you're going to give me some antacids, and you want me to take them for a few weeks, and then I'm supposed to call you if they don't work.
Right, exactly. Let me just clarify a couple of things that I might not have made completely clear. There are also some diet changes that I think might help with the chest pain. That's the handout that I gave you.
Oh, that's right. You said that when I'm having that evening coffee with my husband, that cutting that out should help decrease the pain.
I'm hopeful that might make it a little bit better. Step 7. Finish with an engaging closure and reflective practice. The final moments of the patient encounter are key to ensuring patient engagement, compliance, and follow-up. Summarize the main points of the visit or your visit plan. Ask whether everything was explained clearly. Inquire whether the patient has any additional questions. Make a positive final impression. Engage the patient in following up with you or the practice, and escort the patient out. Taking a few moments to engage in reflective practice will ensure that each clinic encounter is of the highest caliber. And in addition, I don't want you to wait a few weeks to call me. I want you to call me in a couple of days and let me know how you're feeling.
Oh, okay.
All right? It's really important for me to know how you're doing. Did I explain everything clearly? Do you have any other questions?
No questions that I can think of.
Wonderful. Well, thanks for coming in today. Let me walk you out.
Okay. Thank you, Dr. Meltzer.
That concludes our session. My goal today was to simply demonstrate 7 evidence-based strategies to promote engagement, empathy, and rapport. Perhaps you can select one and incorporate it into your next clinic session. When you feel ready, try another. Remember, there's no one perfect way to speak with patients and their family members, and in time, you'll find your own voice. Thank you so much for watching.